Huples cat. After nights, top of one of the 3 parking garages that we have. This place has grown enormously, this hospital. And last night I went around the new tented hospital. So sit back and watch it, and I will put some commentary in it and tell you what I think. The whole concept is actually dramatically a bad one. Some things are a good idea. Clearly, bed capacity is really important in a pandemic. So the long promised from the Trudeau National Government in Canada of field hospitals have arrived, and we're building one in my hospital in the car parking lot, one of the staff car parking lots. One of my jobs at night is to actually be in charge of the entire campus, so I'm actually in charge of it. I have still received absolutely no official notification that we're building this tent, or that we're putting up, or what our role is going to be going forward looking after it. There have been a couple of tiny notifications on the general email platform, but not targeted emails to me. I'm kind of concerned that I'm not being kept in the loop. So me being me, I was working with a co-worker last night and we decided to go and have a look at it. So we gave a security call and we got a very pleasant tour. One of the first things you'll see in this tiny little clip is her getting into the security car. There's no actual sidewalk access to this place. The only way to get to it is exposed on 2 parts of the journey, or 1 part of the journey, to the elements. So if we're going to move staff and patients between the actual main buildings and the tented area, we're going to have to probably hire a lot of Ubers or use up a whole bunch of ambulances. What I have heard is that the logistics for this have not been decided. They don't know how to staff it. They don't know how to use it.
So my opinion of why Sunnybrook was selected is space. Certainly we're very fortunate to have this amount of space, very unusual for an urban hospital like this. But we also, Sunnybrook has a long history of working and leading things like emergency preparedness.
And that's no surprise. Countries like the United Kingdom have done a terrible job with COVID, but they did some aspects right. They got Red Cross, retired doctors and nurses, and many others to register nationally. And they put them to work, and they're working really hard right now in vaccine centres, which is why the United Kingdom has a phenomenal amount of vaccinations done, and why Canada has one of the worst records in vaccination of the population in the world. The last time I looked, we were the 97th best country. There was 96 countries that vaccinated more of their population than Canada. This is a major issue. Without the staff to staff expanded capacity, it's very hard to do it. Now, we're not in the 3rd wave at all. Some people claim we are not. I will show you now figures from my hospital. We have hardly any COVID patients. What we have is generalized congestion because there's absolutely refusal to slow down surgical cases that are elective as we spike with COVID. And so we're still trying to get over the fact that we were doing elective surgeries all the way through the 2nd wave, which was a huge mistake.
Overwhelming conditions doesn't mean that every single patient in hospital has to have COVID before you can declare overwhelming conditions. We've already lived through 2 phases of overwhelming conditions in hospitals because the sheer size of those waves, the 1st wave and especially the 2nd wave, pushes out all sorts of other health services. Tens of thousands of people are denied access to the care that they need or we're counting on. So to me, that's overwhelming.
The reason it was a mistake is if we started to get casualties in the hundreds to 200s a day, having done all these elective cases, it was going to be a major issue. We got away with it by the skin of our teeth. Let's assume the 3rd wave's coming. It's not coming. I'm telling you that I do not believe there will be a 3rd wave of significance in Ontario. There may well be a lot of cases, and like anything, like flu, if there's a lot of cases of COVID, I don't really care. What I care about are the ones that need hospitalisation and get sick and die. That is why COVID is fundamentally required a huge response and requires you to get vaccinated as soon as you can.
Raising tents, just in case COVID-19 numbers go up as well.
So ready for anything that might come our way.
This mobile field hospital, set up in this parking lot outside Sunnybrook Health Sciences Center, slated to be ready in April, up to 10 tents with as many as 100 beds.
That's the maximum that this certainly could provide. We're going to be moderating the number of beds that we have inside the tent based on need.
The facility will be fully equipped with ventilators, oxygen machines, and portable x-ray machines, all in preparation for a potential third wave.
All of the things we've been doing across the course of the last year have been based on what the experts are telling us from modeling.
Earlier this year, the federal government promised 2 mobile field hospitals in the Greater Toronto area. This is one of them. But is it enough to prepare for a third wave that could end up being a tsunami?
Having vaccinated about 3% of Canadians, we have only vaccinated people over the age of 80 who live in nursing homes. We have only vaccinated care workers in those nursing homes and care workers like me. And yeah, my second dose of vaccine's been bumped. For no reason. We're going to get vast amounts of vaccines we already have. There is no need to spread out the first and second doses. Again, it's poor planning. Having been bitten once a few months ago with a vaccine shortage, the people in charge cannot go, well, you know what, we have hundreds of thousands of vaccines. We have a fairly resistant vaccination population under the age of 50. A lot of them won't be getting vaccinated. Why are we expending it beyond the 42 days? Well, they are. With no scientific research to show it's safe, with no scientific research to prove it's a good idea, they're going to do it. All through this pandemic, the people in charge have been trapped with previous pandemics.
But we also, Sunnybrook has a long history of working and leading things like emergency preparedness. You'll recall our Code Orange response of a couple of years ago for the van attack. We oversee and operate the emergency medical assistance team for the province of Ontario, which is a similar sort of structure as this, and that's been deployed a number of times.
You'll see the head of emergency planning here refer to the fact that there was a van attack with very few casualties a couple of years ago, and we did a great job at Sunnybrook. Yes, we did. But the bottom line is it's very different from having 15 mass casualties come in from a van attack and having 1,500 people need hospitalisation because of a major pandemic wave. It is actually entirely different. If you're a clinician, if you're not a clinician, you just think it's IMS protocol and you go down the list. And what that means is delegating everything to clinicians who try and make it work.
So about how many people would this house when you've fully completed putting it together?
Yeah, so we are initially going to have it set up for a maximum of about 84, 85 beds. It can be expanded out to 100 beds if necessary.
Clinicians have been kept out of this. This is why we've had problems with vaccination. There ain't no nurse who knows anything that would have set up an electronic registration for the over 80 group without a dedicated and functional phone line. Who would have done that? And waiting outside in February? No clinician would have gone for that. Nobody asked for our feedback, nobody cares. The analogy of this, if you have an analogy of this, would be SARS in 2003. I worked through that. All of these people that I work with at the hospital in charge of making decisions did not. A lot of them were in high school. Okay, so that's a little bit of a rant. So yeah, we have this field hospital. It's great. But of course, with information not being open and not being transparent, rumours fill the void. What I've heard is that eventually it will be a vaccine centre. I doubt it. There's no parking. But you never know. They might try to do it, but there is no parking. Obviously, we took out the car park. As you'll see now, a lot of the news reports are reporting that they fully function with oxygen and ventilators, giving the impression that huge numbers of ventilated people will be put in these things.
It's being built at the staff parking lot at Sunnybrook's Bayview campus and will be equipped with ventilators, oxygen machines, and x-ray machines.
The facility will be fully equipped with ventilators, oxygen machines, and portable x-ray machines, all in preparation for a potential third wave.
Given the first and second waves, there is no guarantee there will be a third wave. Nobody knows there will be a third wave. Nobody knows that. We don't know if it will be worse, the same, or not existing, or better. We don't know. What I can tell you is unless there's a radical change in the virus, and there has not been with any of the variants, a radical change in infectivity and symptomology, the people who end up in hospital mostly are the people over the age of 60, and most of them have pre-existing health conditions. There are young people in their 20s and 30s with no problems who catch this disease and die from it. But it's pretty rare. What isn't rare is people over the age of 80 catching this and requiring hospitalization and dying from it. 500,000 in the States. Not all of them are elderly people, but a lot of them were younger. But most of the younger ones, if you look at the data, were actually healthcare workers. We have vaccinated our elderly at-risk population. We have vaccinated most of our healthcare workers. Where is this influx of patients coming in? And then they have the cheek to say, oh, well, other things make hospitals congested, so we can use it for that. No, bad planning. Not being able to conceive of anything outside the norm is what congests hospitals. This is why they kept my hospital shut to elective surgery for 9 weeks with almost no cases. This is why we had empty wards for 9 weeks while they didn't do any cases, and then they go the opposite way because they're not able to be flexible enough on their feet to actually look at new data and actually react accordingly. It all has to be anchored into what they know, what they're comfortable with, and because most of the decision makers are not clinicians or haven't been clinicians for decades, it's not an appropriate clinical response generally. So what's actually in these tents? Well, I'll show you a little bit of a walkthrough now, but I will interrupt it and explain what's going on. It is at night, it was quite windy, but I think you'll find it kind of interesting.
We should only mix the tents. Alrighty. Well, they fully set it up. They fully set it up.
Wow.
Bit of a hike if you want to rush with that.
Oh yeah. What walk back to the hospital?
Yeah, I was offered to. Okay.
Oh my gosh.
Come on, that's good for you. Yeah, east facing, right?
Yeah. There's like. We just go inside.
Yeah, let's see why not. It's just an empty tent. It's literally just empty. So how do you get through the other side? So it's empty. Okay. So yeah, you cannot get an ambulance down here. Be interested if you can on the back. Oh. Seal that. Just rip this through the window, eh? Yeah, there's one on the inside as well. Yeah. Oh. So they reckon 10 in each one, right?
Yeah.
So if this is empty, you could drive up an ambulance on this side.
Yeah.
I suspect it won't be empty. See, the thing is, if like that's your store tent, right?
Yeah.
So you're gonna get kind of wet.
Oh yeah.
Are you able to go in them or not? Are they all sealed up? Yeah. I'd look through the window, but these ones are just blank. But yeah, there'll be supply areas, I think. Yeah, my issue is like getting ambulance access and stuff, because I've got a feeling. I mean, the patients they're planning to put here are actually hospital patients, right? Old people. Yeah, it's not quick. Oh, hang on, there's windows open here. No. Yeah. Is it open? Yeah, it's open. It's completely empty. Yeah. Nice. Woo. Okay. So this would be for 10 patients.
10 patients in here?
So if you're figure 2 meter separation, each bay's got an outlet, eh?
Yeah.
So they've designed it for 4 plus 8, and you can hang shit up to block each one and make it ISO.
Yeah.
So they're designed for 4. So if they want it, they're designed for 8. So if you put in 10 in, you're using stretchers for sure.
They don't need lots of oxygen tanks and all of that, right? Portable oxygen.
Yeah, everything's going to be portable, which will be a huge issue for COVID.
Yeah.
Look, there's the fire exit. Nice. They need heaters,
Oh yeah.
and they need air conditioners. Yeah. That sort of thing, flooding. That's a flood point. All right, I guess we're going to be over here dealing with this. Thanks. So they're definitely planning stretchers. Put the old people on stretchers, that's a good idea, isn't it? It's right by a main car park, which is not the best thing. Yeah, cool. Thanks guys, that was fun.
It isn't what you see. This is not going to be for ICU. What I have heard, and it's rumour, is that it will be about 40 to 45 patients who are required to go to nursing homes whose families don't want to put them in nursing homes. You will recall that there's been a lot of deaths in nursing homes. We actually have, for the first time in a long time, space in nursing homes. So they're planning to put 45 elderly patients on stretchers in these tents. I fundamentally disagree with that. Our elderly population should not be on stretchers. They should not be in tents. They should not be next to a main road. They should not be in a car park. They should not have a helicopter flying over them on a regular basis, making an incredible loud noise, bringing traumas in and burns patients. But we need the space, Huples, I hear you cry. Right now, we have beds, physical beds, with staff for about 40 patients that we could move into in our smaller hospitals that are attached to us. We're not doing it, you know why? Families don't want us to move them. Okay, so we'll just shove them in tents, and because they're on our physical campus, that's going to be okay. I predict if they try to do this, there'll be several problems. The first problem they're going to have is that the families will go absolutely ballistic, and rightly so. These are not camping tents, quite right, but they are tents, and you'll see inside of them, they're plastic vinyl tents.
Do you ever think security's just glad of an excuse to do something different?
I know.
So that must be like the dining hall. That must be the dining hall.
That's the dining hall.
Yeah, for the staff, for the nurses. Yeah, so they're going to lay this stuff down between the tents so you won't be able to drive over it. So I'll have to take them out of the back. Well, it took them a year, but at least they're ready for a pandemic now.
Yeah, hopefully they use the tents, not like the ones they did in the EMS.
Oh, I don't even want to. That was like, that aged me, that one outside of Merge aged me about 6 years. Oh, it's flooding again. The only use that I ever had was for the emergency to sleep in at night.
Yeah.
Because they never had the staff to do that tent, and it was a waiting room tent, so you don't really need a lot of staff.
I don't think we even use them.
You put patients in here, we're going to need 3 minimum per tent, with circulating on top of that for every shift. So if you use all 10 tents, you're going to have at least 40 to 50 staff here.
Sweet.
All the time.
I guess a lot of nursing students are getting, you don't need to take your last year. Yeah,
It's
you're
okay.
good.
We can use the screeners, right?
Well, it's not going to happen because the at-risk groups have been vaccinated, and so is healthcare workers. So where are we getting all the patients from?
Yeah.
Yeah, I think they need
Like, no, seriously, like it doesn't make any sense. But I guess they had spent the money, so they had to put him up.
Probably a huge waste of year.
Well, the thing is, though, if we need this amount of capacity, we have got a lot of staff at home sick. So it'd be interesting to see, like, I know in England, like, they use the Red Cross and stuff, and they brought them in, they brought retired people in. That's who's doing their vaccine clinics, which is why they've got, like, 28 million vaccinated.
In one of our meetings, I heard that this was eventually going to be the vaccination clinic when we start vaccinating the mass public.
Well, that would be a smart thing to do.
But I don't know how that's going to work out or if it's going to even happen.
Well, that's good, but how are they going to park? Given the fact that's all staff, right? Yeah. Oh, I know. Logistics to be worked out, right? That's what they said. Yeah, okay, whatever.
They just plopped it here. Oh, we'll figure it out as we go.
That's like spending trillions on a moon rocket and saying, oh, we'll figure out how to power it in a bit. I mean, good on them for doing this, but this is like at least 9 months too late. Wow. You know, if they had spent this amount of money on N95s and stored them and gave everybody in healthcare N95s, as many as they wanted, a year ago, it would be fine. Well, fully operational, this puts our acute beds up by 33%. So you need at least 33% more security, etc., etc., etc.
Yeah, they've started hiring.
Another third of the department.
Yeah, pretty much, yeah. But yeah, no, if you have to use this, we're in real trouble. Anyway, like, oh well, cool.
You will see family with placards at the fence, screaming abuse, agitating about why is my grandfather in a tent. And quite right, they paid taxes all their lives, they should be getting decent healthcare. We've known this has been coming for 12 months. So why do we have to put people in tents? Why haven't we created physical walled and roofed capacity? I don't know. We've created some capacity, but it's all been used by over-elective cases. We created 12 ICU beds for COVID. Pretty much all of those beds are filled with normal ICU patients. However many beds we build, we will fill them.
This has been a Dog in a Bonnet production, 2021.